All right, welcome to the second hour of the Elias Macko Show. We're with you straight through until noon. This is my first day back since the holidays, so Happy New Year to everyone. And I remember it was right before the holidays, right before I took off for the holiday period. It was on the Big Five. We were discussing how Health Minister Christian Dubé, he had a plea for Quebecers. As the holidays were starting, he's like, hey, please, could you not show up to the ER? And I said to myself, well, geez, how's that for a plan, right? When you're looking at the dire strait of our ERs at Quebec hospitals, how's that for a plan? Just tell people not to show up. Now, of course, the holidays are over. We are seeing ERs in a dire state at capacity and capacity plus yet again. Now, on this show yesterday, thanks to Dan Delmar, by the way, who took over for the last few days, he spoke to one woman about her ER experience. Her name was Lisa Goldman. Here's what she had to say.
Waiting for a hospital bed for 5 days. Sleeping on a gurney in an open reception area surrounded by people in terrible states of misery, with doctors just rushing from one patient to the next and nurses as well. I mean, I didn't have a pillow. I was on a gurney so narrow and so hard that I couldn't turn over. I was attached to an IV. I had to call a nurse to detach me from the IV every time I went to use a public toilet. And that's the way life was for 5 nights in a brightly lit emergency room.
Lisa Goldman's story about dealing with the Quebec ER over the holidays. Now let's go to one family doctor who is questioning the plea from the government not even to show up to ERs and how the system's being managed in the first place. Dr. Laura Sang is on the line, family doctor in this city. Dr. Sang, welcome to the program.
Hi, thank you so much for having me.
So, first things first, what did you think, before the holidays, right around the start of the holidays, when the health minister's like, please don't show up to the ER? What were your thoughts on that?
So I was pretty surprised that was the main approach, that, the main message that he wanted to send, because I think that it's hard for people to judge whether or not they need to go to the ER without having good access to primary care and triage and having questioning. Typically in my practice, most patients, it's the opposite. It's that I find something very urgently wrong and they don't want to go to the ER because of the wait times and the many things that were mentioned by the woman who spoke previously. I think that the congestion in the ER is a sign of a much bigger problem in the healthcare system, that people aren't able to go through the flow as one would expect, from outpatient to ER to inpatient to back home or to other areas where they may be staying, like rehab or fish facilities. And I think that what we need is more manpower, more personnel, more beds, more access.
And it's so interesting because there was an example given when they had that press conference right before the holidays. They threw out this example of like a 25-year-old healthy man that shows up in the ER because he has a fever and saying, well, that person should not be going to the ER. And maybe there are situations like that, but I would imagine what you just said, people that actually really do need to go to the ER but avoid it because they don't want to deal with waits, I bet you that's probably what's happening far more than the person that's overusing an ER. Would you say that's the case?
Yeah, I think that would be likely the case. I've had patients, with various symptoms, cough, fever, abdominal pain, even chest pain, that are trying to wait things out at home because they're afraid of the wait times in the ER and they would rather take their chances with supportive care. I think that when people make the decision to go to the ER, it's usually because something is very seriously wrong and they're worried for their safety staying at home.
So how much of this has to do with getting that care before it reaches the point where you need to go to an ER? And I know family doctors come into that. I know the list of people who are waiting for a family doctor, that list keeps increasing. So how important, Dr. Sang, is it for doctors like you, family doctors, your role in solving this?
So I think that, we play a critical role in trying to keep people out of hospital, as well as our many allied healthcare professionals or different nurses. I think that when people have access to primary care, firstly, they can better control underlying health conditions that might put them at risk for hospitalization, like COPD, asthma, diabetes, etc. as well as, access to timely care that, for example, if someone tests positive for COVID and is able to get Paxlovid, or someone has pneumonia and is able to get antibiotics early on before things progress to a point where they're deteriorating and they're having increased oxygen needs and may need inpatient care. I think that we play a critical role in preventing that kind of deterioration that might lead to someone having to consult an ER.
How should someone judge for themselves going through all those things? Maybe they don't have a family doctor and they need to make that determination. And now they've heard, like the health minister say, don't come to the ER. So now they're thinking about that as well. How should someone make a determination for themselves about when things are serious enough where they should be going to the ER?
So I think, at the first signs of infections, you can start with conservative treatment, so hydration at home, trying to get access to rapid testing when possible, avoiding contact with others. And, the first 48 hours, you can monitor as best as you can. But at any point, especially if you have underlying conditions, you're starting to have trouble breathing, you're starting to have trouble swallowing, you can't maintain hydration. Those are really sort of those critical points where you definitely need to be seen, and I think that you should consult, whether it be through 811, walk-in clinic, etc. But if you're in some kind of imminent respiratory distress, you should go to the ER.
We're with Dr. Laura Sang, a family doctor here in Montreal. Dr. Sang, what have we not mentioned? What have we not talked about during this interview that you want to really focus on?
I think clear public health messaging is important. I think that people need to know what resources are available and when they can go there. So I think, promoting vaccination campaigns like they've done in the past is important, making sure it's clear when it's time to get vaccinated, who should get vaccinated, where those points are accessible. I think making sure that there are enough spots on Clic Santé and elsewhere for people to sign up for vaccines during sort of that critical window, October, November, to make sure people are vaccinated before the flu season hits full force. I think reinforcing the fact that even if you test negative on a rapid test, you could still have COVID, and that you should still isolate and retest yourself. And I think that, just continuing those same sort of measures of hand washing, wearing a mask when out in public, trying to socialize in smaller groups, those are all good things that can help protect people and make for a happier and safer holiday period.
Have you found it difficult maybe to coax some of your patients into getting those vaccines, like the annual vaccine for the flu or getting a COVID booster? Because I know a lot of people are talking about vaccine fatigue from the last few years. Have you found a difficulty?
So I know that some of my patients are a little bit hesitant, especially after having had COVID, and anecdotally themselves have found that they had a more mild disease. I think what we need to remember is that vaccination is supposed to help on a population level, to help generally reduce the spread and transmission, have people have symptoms for a shorter time, and hopefully have a more mild disease burden if they do get sick with something. So I still think that, vaccination is one of the cornerstones of preventing a nastier COVID and flu and RSV season. And I don't think it's something that should be underestimated. Well,
Dr. Sang, let me tell you something. Here at CJD, it seemed like everyone got sick at one point. Over the last couple of months, everyone got sick except for me. And I went because my fiance is pregnant. So in October, I said, you know what, I'm going to get the booster shot of the COVID booster and I'm going to get my flu shot all at the same time. And now, knock on wood, I hope I don't jinx myself. And I was the only one here that was unscathed. Everyone else was forced to go off air at one point because of some virus or flu. So I certainly saw it for myself. We have to leave it there, Dr. Sang. I want to thank you so much for coming on.
Thank you very much, and stay well.
That's family doctor, Dr. Laura Sang.